Hello everyone, I am Dr. Madhumithra, Consultant Pediatrics in Pediatric Intensive Services at Rainbow Children's Hospital, Sarjapur Road, Bangalore. Today I am going to talk to you about choking. So we'll discuss something about what is choking, how to identify it, what to do when you find your child is choking, and how to prevent it. So what is choking? Choking is a critical event when a child uses small objects, puts them in the mouth, and that object obstructs his airway, making it difficult to breathe in and out. So this is very common in children who are between 1 to 5 years of age group. Because they are naturally curious, they tend to pick up objects which are small, like marbles, small cut vegetable pieces, groundnuts, and try to explore them with their mouths and ending up choking sometimes. So what to do and how to identify if my child is choking? So if your child is choking, you will find your child having sudden onset cough, sudden onset of gagging, sudden onset of difficult to breathe in a child who is otherwise healthy. If you find your child choking on something, first step to do is making few decisions, like whether your child is conscious, breathing well, is able to produce sounds or speak. If your child who is less than 1 year of age group and you think he is choking, you have to perform a few steps. So if you find your child who is less than 1 year old and who is choking, place him on his abdomen and support the baby with your fingers on the cheek and check for the object in his mouth. If you find the object, try to sweep across the mouth and remove the object. If you don't see any object, do not blindly poke the object, because you might end up pushing it further. So if you do not find any object, place her on abdomen, support her chin and give 5 brisk back blows like this, using the heel of your wrist. And after 5 blows, you have to check whether you can see the object again in his mouth. If you see any object, try to remove it. If not, please continue the back blows. You can continue this procedure till whether the object is expelled or your child becomes unconscious. If you find your child is not breathing, not conscious, turning blue, then you have to be more cautious. It's a critical situation where you have to call for help, send for ambulance, and then do CPR, which is chest compressions. If your child is above 1 year age group and you find him choking, then he'll have bit classical signs, like he'll be holding his neck, trying to communicate with you that he's choking. He might not be able to produce sounds. He'll be finding difficulty to breathe. Then what you can do is make him stand, lean forward, and ask him to cough vigorously. If your child is not breathing, not conscious, you have to perform something called chest compressions. If the child is not breathing for a while, the oxygen levels in the body becomes lesser and it becomes difficult for the child to breathe, and it has a bad implications on the heart functions as well. So you have to be more cautious. So how to do chest compressions? To learn about chest compression, we have to learn something about cardiopulmonary resuscitation. We call it CPR training. I also encourage all the parents to undergo CPR training to help the children appropriately at the immediate. So what can you do to prevent such events? So most important thing is child-proofing the environment. The small objects like marbles, peanuts, cut vegetables should be kept out of their easy reach. And next thing is safe eating habits. You have to ask the children to sit down while eating. Do not talk or laugh or running during eating. So next thing to do is providing them age-appropriate foods. Younger ones have to be given bit softer in consistency, semi-solid in consistency kind of food, and as a child grows older, then you can give them the harder foods. If the parents are well known about these events, educating ourselves and to perform these maneuvers, it becomes easier to prevent the critical events. So most important thing to note here is prevention is better than cure. Make the environment safer for the children at home, and so that we can help the children who are choking better. Thank you.